Dr. Fashawe will guide the tour. Dr. Fashawe will lead our dignitaries from excellencies round the. Just the first line, please. All the guests, please be seated. We're not done with this event. They will be back very shortly. They just want to go around and access the facility. So please, all the guests, please, with great indulgence, remain seated. Just the excellencies. Please, all the guests, remain seated. We don't want too many protocol officers following them, please. They will be back, please. Just the pressmen going with them. Please just remain on your seats. They're coming back. They just want to have a tour of this facility.
So you're welcome again. This is our machine, made possible by your generous donation. The interesting thing about this machine is, when we suspect tuberculosis normally, we will send to the secondary centers, general hospital, to do a mantle test or an X-ray. Today, we are able to make diagnosis of tuberculosis with this machine within 30 minutes. We have also even supported it with a mobile X-ray. Peradventure, your signs and symptoms are sounding like tuberculosis and this thing is negative, we have backup. Thanks to your donation, Your Excellency. And then, once we confirm positive, thanks to the Federal Ministry of Health, treatment is absolutely free. So we are going to do a demonstration test now, and before we finish walking around, the results will be ready.
Thank you, Your Excellency. Now we're going to have a patient come to do the X-ray with the radiographer. So if we can have the pressman please give us some space so that the patient can come in and the radiographer can come in. So the digital X-rays are AI powered. Please, we need to move backwards a little bit, please. Just move backwards, please. Thank you. Can we have the data clerk with the laptop come closer? Please, quickly. To show us the image. Immediately, please. Excuse me. Okay. Okay. Thank you. So he's setting the beam and ensuring that everything is in line. The patient is positioned in the right way so that he gets the best quality picture. The fitting is in line. Okay. Please, can you go ahead and take your shot? He's asking her to breathe in And then with the click of that, he has been able to take the X-ray, and it's done. Okay, and the X-ray machine is off, so it's safe. And then we can move here to see the image on the laptop, the image of the X-ray that has just been taken. Just Her Excellency and a few people, please can we give way, please? Where's the image? It's here, sir. Turn it around, please. So this is the image of the X-ray camera. This is the chest X-ray that was just taken, and we have it, and then it's AI powered. So the AI can give us a predictive score to know if this patient would be likely presumptive for tuberculosis. And then from that, we can also do other things. Then we're moving next to the sputum where the TB molecular lamp machines are, which is what the First Lady brought, ma. So this is the first spot. Here we have the extraction point. At this point, the sputum is here that has been taken from the patient, and the lab scientists would take some of the sputum from this pipette and then put it into this. It's it is very simple, fast, and effective. Yes, ma'am. Into this. Okay, sputum is the sputum is the spit sample that comes from the saliva, and then it's put into the heating tube, and then from there, so from there we move the sample to the heating block. So at the heating block here, it's going to stay here for 40 minutes, after which we move it to the centrifuge here for another 40 minutes, and then taking back here. Then in an hour, 10 minutes, everything should be done and ready, and we'll be able to read the patient's result. That's all. So the test is very effective, it is simple, and it can access about 16. Yes, it's 95 points, sorry. And then we have about 16 samples that can go into the machine at once, so we can do a lot more with the machine than the previous ones we had.
Thank you very much, Your Excellency, for this donation, which has made testing and diagnosis something that will take us a few days, can happen in a few minutes, less than an hour, Your Excellency, in a primary health care setting. That is our joy, that is our hope, and that is our belief that we can end TB. Thank you very much. The next.
Every program we have, we use it as an opportunity, because the federal government and FCT in particular has zero tolerance for maternal mortality. There's no reason any woman should die whilst giving birth. So, we have pregnant women here. We also are happy to let you know that if a pregnant woman has been exposed to someone with tuberculosis, we can test. And the good news is we can prevent mother-to-child transmission. Instead, they don't like coming to the general hospitals. They think we will do CS or take their blood. So this is really a game changer. And for this, we thank you, Your Excellency. We have solar power in case there's no light. We do not depend on the grid to make diagnosis, and treatment commences immediately. Thank you, ma'am. No, that's not what telemedicine, we're coming to you. Governor expected you to check this cleaner this year. Minister of State, Her Excellency, the wife of the Governor of Katsina State, our royal fathers. Pregnancy is something that cannot be hidden. We have decided to use community engagement to reach every pregnant woman. The chiefs know who is pregnant. They know who has just given birth. And I'm happy to inform you that in FCC, well, and the federal government, insurance is free for every pregnant woman. And for the child you give birth to, in his first year of life, insurance is also free. We will take your phone number. If you don't come to us, we will call you. No child should die of preventable illnesses in Nigeria anymore. You are standing before you very important dignitaries. That shows how important you are to us. I will have our Excellency, Minister State Bureau, and the President of the State Bureau, make symbolic presentations to you before we move on to the next one. We are here today to get health education, our health doctoral program, and therefore we are not who is the patient that is Dr. Adeoke? So that's the archive. So that when she comes in, so you tell them already started here. Okay, who are we logging in? Lesson. So Dr. There's a 1228 to 1248. Who is that person? Okay, he said he's joining. Oh yeah, Dr. Akode. Dr. Akode. Dr. Akode. So that doctor is live online. Go and talk. Dr. Adewale, can you hear us? Dr. Adewale, can you hear us? Hello. So that's our network. Is your own network working? Use the globe, please. See your globe. Use globe. No, this is your globe. Oh, so why is it driving? Are you online? I'm online. But what time is your appointment? So, okay,
Just to save it so that I'm not going to repeat.
Okay, well done. Are we going this way or this way? This way first. Yes.
So this is the FCT telehealth portal, and then you go to Adewara, and president of the Shortage of Doctors in this
Adewara from London. Didn't I meet you when I was in London? I remember you.
Yes, very well, thank you. So FCT has won the telemedicine.
No more camera.
Manpower shortages.
For me, please, wait.
Excellency, ma'am, the Minister, sir, what we are trying to introduce in FCT is the concept of telephone consultation. We have realized that human resource in health is something that is a big problem. People are constantly leaving Nigeria for greener pastures. The few we have who want to work are around, but they are far spread around. Limited resources, competing demands, especially in the PHCs. I can tell you that in our area councils, we have over 367 primary health care centers, and we have less than 20 doctors manning all of them. So, what we have done with Mobihealth is significant. It's a game changer. We have signed a contract with Mobihealth. Mobihealth is an organization that has doctors accredited by NCA on the other side of the line. We're going to have this in our PHCs where there is no doctor. And it will interest you to know, sir, that this whole concept started during the project 10 million. When we were getting people with hypertension and diabetes, we were screening, but we were overwhelmed with treatments. We needed further consultations. The general hospitals were screaming that we are sending too many. So we decided to try tele-consultations. When your blood pressure is high, your blood sugar is high, for the first testing, we can't put you on medication. You need to talk to a doctor. So we're here today to demonstrate, peradventure your test has come positive from there. There are other questions a doctor would have to ask you before we put you on medication. And this is a sample clinic that will be left here after today. And how do we hope to sustain it? Sustainability is key. Sustainability is key. How do we intend to sustain this? We will be using health insurance. For everyone that is registered on our health insurance scheme has an opportunity to pick this phone and talk to a doctor. We need to hurry up. Quick demonstration. Who is the patient? Who is the doctor?
The doctor is on the other side.
So you just come in, sit down. We would have booked you to see a doctor. You have to make it very fast.
So the patient comes in. This is the clinic officer. She doesn't. Okay, so they see the patient and they screen the patient.
So the patient has come.
And the patient has come. She will register them here and then book an appointment with the doctor. So they can check here. They don't need to have any. If you know the name of the doctor, you can understand that. Otherwise, they just search and then the doctor appears on the screen. You book the appointment that is available. Then the doctor gets notified. Yeah, I'm doing it. I'm waiting for it to come up. So, the clinic comes with solar power, so it helps to navigate the convecting power shortages. It also has satellite, so we use Starlink. In this case, for the demo, we're using the model. So these are the doctors here. So you can simply go here, you see the profiles of the doctors, and then you can click whichever doctor you want to see. Enter the reason why you want to see the doctor. You have to give a consent, and then once you've given a consent, then the appointment is booked. Dr. Stella is on. So the doctor can then connect the patient on the system, and they appear on the screen. Wait for the doctor to join the room.
Okay.
Okay, thank you.
Thank you very much. For your information, this renewed Hope Initiative kit was also donated by the First Lady in conjunction with the Federal Ministry of Health and Social Welfare. Thank you very much. Motorcycles, we are not stopping there. It will now be time for goodwill and forgiveness.
Thank you very much. Very excellencies at this point. We will have a short performance. Just a very short performance for our dignitaries present here. Okay, so we're skipping that aspect. And at this point, Your Excellencies, I'd like to call a woman who is calm and calculated, very firm, and of course, competent to the
Nobody's live. No, people are following. Keep going. Look for how we can share the link so that we are copy link. Copy link only. I don't need Okay, fantastic. So that's Dr. Fumi Adewale right here. Like
That's the traditional of the TV diversity. Created by our lovely mother, because we do operation. Thank you very much for Excellency. We really appreciate what has been done to FCT and the nation at large. As we all know, tuberculosis still remains a global burden in terms of health, in terms of morbidity and mortality, despite it being preventable and also curable. So the importance of such meeting is to tell the populace about the classical features. How could they run to utilize these important machines that are provided? The aim is to end TB by 2030. As the Chairman Obari has mentioned, for us in FCT, we pray to end TB within this year, if not this month, if not today, as he has mentioned. With the effort of Her Excellency, with the effort of the Renewed Hope initiatives and the Renewed Hope agenda of His Excellency Bola Ahmed Tinubu GCFR, I'm very sure we are almost there. We appreciate the Federal Ministry of Health for all that they've been doing for the support. We also appreciate His Excellency Barrister Yeltsin Wiki, because this is really augmenting and complementing what we've been doing in FCT to end TB, to improve the health status and the quality of life of our people in FCT in general. So I thank everyone for coming, and we need to work together for us to achieve the targeted goal. Let people know, the populace, about the classical features of TB that you become suspected. We had a testament from one of our patients. She has mentioned the issue of cough. If you are coughing for 2 weeks at least, or 3, whether productive or non-productive, are you losing weight? Are you having a sweat, what we call a drenching night sweat? You will be sweating excessively even if you are on the fan or AC. So that is also suspicious. You need to run, whether you are losing weight also, you have to come to the primary health care for you to be able to use this important machine that has been donated by our mother. And then from our own side, I hope the people will really take care of this machine and will use it judiciously for us to achieve, for other people to also come and benefit from this kind gesture of Her Excellency. On behalf of FCT and His Excellency Barrister Yeltsin Wiki, we express our gratitude to our mother for this kind gesture and what she has been doing to help and the people of Nigeria, especially women in general. Thank you very much. May God bless you all.
Thank you very much. Please put your hands together for the Honorable Minister of State, FCT, Dr. Maria Mahmoud. Thank you for those kind words. And she has given that firm remarks that this equipment will be used judiciously. And so shall it be. I'd like to welcome next a man who is working the vision of His Excellency, the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu. in his renewed hope agenda, in saying that the reforms in the health sector is, tilted towards a resilient and integrated health system in the country. Please put your hands together as we welcome the Honorable Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, CON.
Her Excellency, the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, CON, the Grand Commander in our fight against diseases like TB, HIV, hepatitis, syphilis, cervical cancer, and many more, who is here ably represented by Her Excellency Ambassador Professor Olufunke Abdulrazak and the Folake Abdulrazak, the wife of the Governor of Kwara State and Chairman of the Forum of Spouses of the Nigerian Governors, My Excellency, the First Lady of Katsina State, my own dear sister, the Honorable Minister of State for FCT, who is here. I think I'm very glad that she's here, the chairperson of the Nigeria Stop TB Partnership, Your Royal Highness, the 7th SO of Wari, Dr. Ibrahim Umar, the Mandate Secretary of FCT for Health and Environment, and the colleague Mandate Secretary that is also here, the Chairman of the Wari Local Government Area Council. Please permit me to stand on the already established protocol. It gives me real honor and is a privilege to be here as we unveil this new TB diagnostic facility that Her Excellency, the First Lady of the Federal Republic, has donated as part of her Renewed Hope initiative. I think you'll all agree with me that it is promise met and it is promise kept. Her Excellency promised, donated 1 billion naira in 2024 and again 1 billion naira in 2025. And she has delivered decisively on those promises to see that Nigeria ends TB by 2030, and as we have heard by today. We are very fortunate, the people of Buhari, the people of FCT and fellow Nigerians, to have a First Lady who cares about the people. Her heart is deeply connected to the sufferings of Nigerians, and she is doing all that she can from her office with her goodwill to see that we bring relief. So we thank the First Lady for all these tremendous donations, and we pray to God to replenish her sources, to strengthen, to protect, and to continue to guide her footsteps. This effort is complementary to what the federal government, through the Federal Ministry of Health, is doing to ensure that Nigeria provides all necessary instruments that we end TB by the target date. And the demonstration of this commitment by Her Excellency is reverberating across the world, because she's the global TB champion, she's the Africa regional TB champion, and she's our national champion. From the Federal Ministry of Health, we are working hard under the direction of the President to ensure that drugs, all the tests, the human resources are available, and integrating TB care into the primary healthcare system, so that our compatriots, like the advocates that we've had, will not suffer needlessly from a disease that is indeed curable. It could be preventable. And by working between the federal government, states, and local government, I am sure, with the leadership that we have in our country, we can be able to achieve this objective. Beyond that, I'm sure you'll all agree with me that President Bola Ahmed Tinubu, GCFR, is revolutionizing healthcare in Nigeria. We're seeing rapid transformation, alongside with all the state governors, our local government chairmen, the private sector, and our development partners, see steady progress in expanding primary health care, in renewing the infrastructure in our federal facilities, incentivizing our health workers, and mobilizing our society to ensure that our health outcomes get better. That revolution is underway. We are very pleased that in the first 3 months of 2025 alone, more than 36 million visits were taken to primary healthcare centers all over Nigeria in 3 months alone. That is showing that Nigerians are responding, and we're seeing the manifestation of that movement here in the FCT, under the able leadership of the Minister of the FCT and the Minister of State and the Mandate Secretary. We've seen effort to expand antenatal care access, make it affordable, have telehealth, and the diagnostic capabilities that are being provided here. So I would like to thank you, Your Excellency, for being here, and all those who have supported this effort as part of the bureau, and will continue to sustain this effort. May God bless the Federal Republic of Nigeria. Thank you.
Thank you very much. The coordinating Minister, Federal Ministry of Health and Social Welfare, Professor Muhammad Ali Pate. Please, a round of applause for the Honorable Minister there. Of course, each and every one of you, Your Excellencies, have lent your voices to this great initiative by Her Excellency, the First Lady of the Federal Republic of Nigeria. And we hope that many lives, millions of lives will be saved. At this point, Your Excellencies, I'd like to call on the Director of Public Health from the Federal Ministry of Health and Social Welfare for the vote of thanks, Dr. Godwin Intadom. Please, a round of applause for him. He's a man of action, but not of many words. Please appreciate him.
Thank you very much, MC. In this case, I will not have to stand on the existing protocol. When we look at the caliber of people and the high table, Your Excellency, the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, who is the global and national stop TB champion, ably represented by Ambassador Olufolake Abdulrazak, the Honorable Coordinating Minister, Federal Ministry of Health and Social Welfare, and Minister Professor Muhammad Ali Pate, CON, Her Excellency Dr. Maria Mahmood, Honorable Minister of State for Federal Capital Territory, the First Lady of Katsina State and other excellencies present here, Honorable Dr. John Gabaya, Chairman, Buhari Local Government Area Council, Royal Fathers represented here by Dr. Ibrahim Baba, the Mandate Secretary, FCT, Health Services and Environmental Secretariat, Dr. Adidolapo Ayokunle Fashawi, the acting chairperson of the Nigerian TB Partnership, Dr. Queen Ladipo, distinguished guests, ladies and gentlemen. We want to thank you exceedingly for coming to this program. It's really important, giving us a little background. Globally, there is over 11 million new cases of tuberculosis detected annually, and about 1.3 million deaths. Nigeria is one of the 8 countries that account for 65% of global cases, and Nigeria has the highest prevalence in Africa. And here we detect about 350,000 cases. Unfortunately, like the coordinating minister has said, tuberculosis can be detected, can be treated, Then most importantly, the treatment is free. Unfortunately, we are still suffering from high incidence of morbidity and mortality as well. We are exceedingly glad and very grateful to the First Lady for this wonderful initiative, which has continued. She started last year and she has reiterated and continued to provide live through the promise she has made. And we are glad today to solve a very major challenge associated with TB diagnosis. In the past, you go to the facility, they do your x-ray, you go home, you come back in about 3 to a week, 3 days to 1 week, to get the result of the diagnosis of the test before eventually they commence treatment. Just like we have experienced here, in less than 30 minutes, everything was done. And that is the new innovation this administration has brought on board. And we believe strongly that with this, we are going to crash down the burden of tuberculosis in Nigeria. Like the chairman of the local government has said, area council has said, we are ending tuberculosis in FCT today. But let me reframe it. The